everyone. Welcome back to my YouTube channel. It's me, Blessing. Thank you for the love. Thank you for the support. Thank you for showing your love to me. I did not take it for granted. And today, I have another guest in the house. I have Nurse Idris in the house from Australia. We've been going all over the world. I've brought people from UK, US. Now we are in Australia, another continent of the world. Nurses are all over the place and we are making impact. So today we are going to hear from her how nursing in Australia looks like and what we can learn for people that want to migrate to Australia to practice nursing. Thank you. Thank you, Nurse Idris, for honoring my invitation. Thank you so much. Despite the time zone difference, you still deem me fit to honor my invitation to come to this channel. This channel is basically to inform people out there, people that are trying to migrate to other countries and they are finding it difficult or they think is something that is not possible to do. So that's what actually brought the idea, like letting people know that it's doable. People are doing it, people are moving out, and people are making impact. Thank you so much. Can you please give a brief introduction about yourself, your background in nursing, and when you transitioned to practicing in Australia and everything? Just a brief background information about yourself and your nursing career. Thank you.
Okay, good morning from Australia. Thank you, Nurse Blessing. Thank you for having me here. It's my pleasure to be here. Okay, brief introduction. My name is Shade, Folashade Idris. I'm a registered nurse, registered midwife, and a registered mental health nurse in Nigeria. So I practiced nursing in Nigeria for close to 12 years before we moved here. So we've moved here over 7 years now to Australia, Western Australia to be precise. So this year will be 8 years. So my transition from Nigeria nursing to Australian nursing is an interesting one. So I'm a mother, I'm a wife, and yeah, that's just about it. Introduction about me. Yeah.
Thank you. So how is nursing generally in Australia? Because when I moved to the United States, I saw that things are practiced differently, especially in the clinical settings. Like in Nigeria, you must be a perioperative nurse before you could practice in the operating room. You must be a psychiatric nurse before you could take care of psychiatric patients. You must have your specialty before you could actually practice in that area. Except if you are a general nurse, you just work in the general area and you can also work in the clinic. But when I got to the United States, I discovered that the main thing you need to practice in any aspect of nursing is for you to get your NCLEX RN, as in you must just be a registered nurse in the United States. Then you could navigate yourself through any aspect of nursing. There's no discrimination that because you don't have psychiatry certification, you can't practice psychiatry. Is it also like that in Australia, or it's just the way it's been practiced in Nigeria?
Australian nursing system is a lot different from Nigeria. I would say that from what you've just said is similar to the United States. It's closer to the United States than to Nigeria. Now, also here, once you finish, it's 3 years nursing degree, everyone goes to the uni. Everyone, there are no nursing school except you want to do enrolled nursing, which is like college, and which I think it's the alternative is like practice nursing in other countries. So, but if you are going to be a registered nurse, you have to do 3 years degree. When you finish, now in Australia we have postgrad experience. Like when you finish, when you graduate, you can either say, okay, this is where I want to work, or I just want to find my feet around and see what resonates with me. You understand? You can do postgrad. And what postgrad means is you have a year after your graduation to be under tutelage, not tutelage per se as if you're in school, but you are being under like a registered nurse or like a senior person which just watches what you do. Now, people decide that, okay, I want to be a cardiology. I want to be in cardiology nursing. I want to be in dermatology. So they use that to step into their specialty. Do you understand?
So they get a mentor that they will shadow.
Yes, like a mentorship, and it's acceptable. It's part of the program. A lot of people do that. A lot of people don't. So it's not compulsory. Like, I didn't have to do it. Like, you can say, this is where I want to work, and you just apply to the hospital or wherever the specialty is, and you get job and you start. Like, you can finish your degree today, get your APRA license today, and start work tomorrow. You don't have to do the postgrad. But for some people, they feel, oh, I need more mentorship. I need guidance. I'm not comfortable enough to stand on my own. So they have like a year, like supernumerary, yeah. Somebody is watching you, like not watching, but at least you are accountable to someone. Like you cannot do some shifts by yourself if you are doing your postgrad. So it's acceptable in Australia, and so many people use that opportunity to step into the role, into the specialty they want. Theater nursing, it's not that if you don't do postgrad, you won't get a job. You will, definitely. So many
So it's
people
a
are,
choice to make on your own.
yes,
It's
it's
a
just a
choice.
choice.
It's not a
And it
requirement.
depends on how comfortable or how confident you feel to start by yourself. Because if you say, okay, I want to be a registered nurse, I don't want to go through that pathway, then you are on your own. Do you understand me? You're on your own. No one is checking what you do before you submit. No one is seeing your procedure before. You understand what I'm saying? So that is one. So, but even at that, when you can split it into two, that, okay, 6 months here and 6 months there, because it's 1 year. It's 1 year, it's level 1.1, or 1.0, depending on where you are working. So that is one aspect. That is one pathway. The other pathway is you finish, then you start. Then you start building your confidence. Then you start, And just like you said, even here, if you decide that, oh, this specialty is not for me, you can decide to go to another place. You can decide to change. You don't have to go to school to become a mental health nurse to be able to work in psychiatric hospital or mental health hospital. No. You might say, okay, I want to do my master's. It doesn't make you more qualified than the person that has experience in that field, that has been there for 12 years. Neurology, someone has been there for 12 years and you just finished, you went to do your master. It doesn't make you. Do you get? So I think here is more about the experience and the skill you have to offer to some degree than going to school like we are used to. Yes, but if you want to step into the administrative role, you want to step into management, that you have to now. Yeah, go.
So that will take me to the next question. Is there going to be a difference in the pay, like the entry pay, for someone that passed through the postgraduate pathway as compared to someone that just entered into the field without postgrad?
Okay, let me use myself as an example. I'm going to use myself as an example. Where I was working before I finished my degree. So my manager called me and he was like, oh, you are finishing soon. When is your registration coming out? I'm like, okay, my registration is out. I'm like, oh, would you want to work for us? Would you want to, because I was working as an assistant nursing while I was studying, So I said, yeah, that's fine. I can go for it. And he's like, oh, we have slots for postgrad. And I'm like, then I didn't really know what I was going into. I know about it, but I was like, okay, let's do it. So, and they put me on 1.0, RN 1.0.
What does
You
that
understand? That means, how we used to say level 1, NO1, NO2, and the way we used to do our ranking. So the rank they gave me was RN 1.0. So 2 weeks I was doing it and people were watching, and I'm like, no, I have it. And I was telling myself, no, Shade, no, you can't do this. Like, you are not a fresh baby nurse. You've been a RN for this, you have experience. And people were even like, oh, you don't need this. And I'm like, let me just give it a go. After 2 weeks, I went back to him. I said, no, I don't want to do postgrad. I want to be RN. Like, employ me as a registered nurse, like on the floor. So, and from 1.0, I was on 1.2.
Wow.
Yes. And that's like, I think like $1 or $2 different, or even $3. So that's just to answer your question, that if you are doing postgrad, you are, I won't say under, because you are still a registered nurse, but you don't have the full-fledged
Economy.
I think it's just particularly to this setting. I'm not sure they do that in the UK. I'm not really sure. And even here, it's not compulsory. I know a lot of people that did not go through that pathway. And I still know a lot of people that's what they did. Now, when they finish, they will, because there you will be submitting, like you'll be doing like, you will be submitting case
Investments.
studies.
Checklist.
Yes, yes. It's like, it's like being in school and working at the same time. And they have affiliates with some unis that, they send their tutors just to see how you are going. You are just on that, like they are treating you as somebody that just finished, and they are trying to groom
Grad.
you.
Like a
Yes.
new grad.
So
I
it's not
see.
compulsory. It's not compulsory at all. You can do without it.
Interesting. Nursing in UK, US. I like this dimension of interview, and I'm happy I'm able to know a little bit of what is happening in Australia through your experience. Thank you. So the next question, how was transitioning for you? Now you're an experienced nurse in Nigeria before moving to Australia. Was the transitioning challenging for you? Like acclimatizing to the Australian healthcare system. How was it? Is there any challenging experience you want to share?
Thank you very much for that question. You see, I won't say challenging. I will not say. I will just say it's a learning experience. I won't say a bit. It's a lot different from anything I did in Nigeria. Like, there is a huge difference from nursing in Nigeria to nursing in Australia. Now, I'll just chip in a little bit of my pathway, because that's how we can come around how the challenges are. When we move here, we move here on my husband's work visa. So I didn't have the need or the urge to quickly jump into nursing and start working. So I had a bit of time to be at home. I homeschooled my kids for like 6 months before they return back to school. So when they returned back, I started looking at my options. Now, as at then, this was 2017. There was nothing like exams or pathway for Nigerian nurses transitioning to Australia nursing. There was nothing. So everybody, as at then, must go back to school.
Oh,
Yes. Now there is outcome-based assessment, where that is another pathway, but now then there wasn't. So I had to sit down, strategize on how I was going to navigate the whole of this. So that's a bit of a challenge, because it makes you feel, oh, so are all my years wasted? Are all my experiences wasted? Do I have to start from the scratch? Do I have to start from the very, very beginning? But that's not the case. It wasn't, because when I started making my research, I found out that I could actually send a letter or give these universities a call and let them know, this is who I am, this is what I've done, these are my experiences, these are the years I've put in, so I did that. I called the union I was looking at in my state, and I said to them, my name is so. I'm a registered nurse in Nigeria. I have these years of experience. I've worked in medical, I've worked in surgical, I've worked in reproductive, I've worked in mental health. I'm a midwife. I told them all of this, and the guy that was responsible for my case just called me and said, okay, this is what we are going to do. Get your transcript ready, get your English test, and come back.
proficiency.
Yes, and I did those things. Start from my English again, passed it, went to my sent message to all the schools I went to in Nigeria, and they sent this transcript straight to them. So, and they gave me 1 year. They said, with everything you have,
3.
yes. So instead of going back to school for 3 years to do Bachelor of Nursing in Australia, or instead of doing 18 months, I was given just 12 months. I was given 8 units. So I just did 8 units, and in 1 year, I graduated. So immediately I graduated, I started working. So my transitioning was not challenging because I had the experience, I had everything they needed. They just needed me to see, okay. And by then I was already working here. I was already working as a nursing assistant. And that role then, because my manager knew I was a registered nurse back in Nigeria, there were some tasks she gave me that was above people that were, at the point I became a supervisor, even not a registered nurse, but she knew I was going back to school. So my transition was really interesting, and I wouldn't take it for granted because it's too different. Now, because of my experience, getting into the healthcare system as a registered nurse was smooth. I won't lie. I'm not going to lie to you. It was very smooth because by then I was already like 2-3 years in the system working and seeing these registered nurses work. And I'm like, oh, this is not that bad, It's not really that bad. And the cultural shock, I've already put that in my body while I was working and studying, So it was really, really interesting. Yeah. So, I mean, I'm not going to say it's a lot of challenges, but the only challenge that I would say I had then was when I was going to do my APRA registration. And APRA is the governing body for nurses in Australia. That's Australian Health Practitioner Regulatory Agency. So when I finished my degree and I was going to be registered, because I have already registered in Nigeria and I just did a bridging course, because what they gave me was a bridging course. So I had to get a letter from the Nursing Council. And that was the only challenge I can say I had, because for months, I did not get this letter. Wow. And they were like, oh, they have not sent it. And I'm like, oh my God. So that's the only thing. But immediately I got that, it was smooth.
Wow, thank you. Oh, so do you want to tell me what you enjoy now as being an Australian nurse?
Oh, first of all, I feel like I've attained my professional height. I finished my degree. I got a scholarship to do my master's free because I wanted to do palliative nursing. Now, yes, I got an Australian scholarship to do my master's, which is really, really good, even though I'm just doing it at my own, at my own pace, because I know that it doesn't really add to, for here. You get. So the another thing is, I think I've gotten to my self-actualization. Like, I'm enjoying the fact that I can be what I've always wanted to be. This country just gives you the everything you need, to attain whatever you want to do. Anything you want to do, just put in your work. I've enjoyed it. Of course, you cannot compare working experience to where we are coming from. No one can compare it. It's just day and light. The money is an addition. You don't even let us even start with that one. But we thank God for everything, and it just makes you know that once you put your mind in it, once you believe in yourself. And another thing I enjoy here is, and this is my own personal experience, even though I'm in a continent that is far away from where I was born, I never felt that I'm outside of, because Australia is so multicultural. It's so many diversities. So even at workplace, you can't find yourself aloof. You understand? You have people to help you. There is a lot of support. That's another thing I noticed. There is a lot of support. You just put your hand up,
It's
like, I need help. People will just come like, okay, what do you need help? Especially when you are just, you know, finding your feet. And, so I've enjoyed a whole lot. And anyone that wants to do it, I'll just say, go for it. Go for it. Go for it. Don't hesitate. Go for it.
Thank you. So there's this news now that nurses that are already practicing in the United Kingdom can easily move to the Australian healthcare system to start working. That getting into Australian nurses register is not difficult. Do you have information about this? And if yes, can you just give a brief summary of how the process looks like?
Yeah, thank you. I'm sure I know some people that have relocated from the UK here to Australia, and I've also checked. It's very seamless. Like people will jokingly say, like Australia is an extension of the UK. So once you are registered in the UK and you have practiced for, I think, a year or thereabout, you just need to go to APRA website and just fill the form as an internationally qualified nurse, midwife, or wherever your specialization is. And yes, there is no exam as at now, as at today. There is no exam, and I don't even think there is need for English tests when you have already been practicing. Yes, in the UK, and I'm sure it's Canada, UK, Canada, US, even from the US. You will just need to go to that the APRA website, the Nursing and Midwifery Council Board of Australia, and put in all your details. And there's self-check assessment, qualification assessment, registration standards, and application processes. It's very straightforward. Unlike now, you know how most of these countries do with their registrations. They have categorized these countries in levels. So UK, US, Canada, Ireland, one level, some Asian countries and few African countries. I think South Africa, it's the only, but every other country, like we have our own pathway. And that's where I was when I came. Like I was telling you the other time, there is outcome-based assessment now from 2020. That started 2020, just 5 years ago. And there are countries that they have put under this umbrella as well, that they can actually assess you and ask you to come and do exams, MCQ. And that's what people say, oh, they do NCLEX in Australia now. Yes, they do. Is NCLEX like exam, but it's not for everybody. In America, in the US, it's for everybody. Once you can sit and pass, yes. But we have streamlined those countries that can even come in and do you understand? So I'm not sure, for now, I'm not sure Nigeria is even there, and most African countries. So I think people should go and do their research, because, things change every year. Around July, they change their policies. But I know one thing for sure, your IELTS is very compulsory, 7 in all bands. Even if it's PT, whatever English exam, it's 7. So, but UK, like you asked, UK nurses can come to Australia, and there is always need. And where they might have the hurdle is, I think you have to get a job, because the visa will be your APRA. APRA is just your license. You have to have a job, and the job will give you visa. Employee sponsor visa, 190, 189. There are a lot of them. And it's PR. It's permanent residency pathway. And in Australia, once you are 1 year on your permanent residency, you become a citizen 1 year. So it's easy. It's easy. I know I have someone that I still spoke with yesterday. She's in Tasmania. She just did 3 years. Nigeria, UK, Australia. So it's a very if you're coming straight from Nigeria, don't even think about it. But if you are already registered in the UK and you want to move, you don't have to. But if you want to see what's going on in Australia, yeah. Yeah,
Wow,
and I think
interesting.
it's similar. Even the practice from, because I've worked with so many people from that migrated from the UK. The practice is, with NHS, and it's way similar. It's
There's
just
always
that
job.
yes, always, 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 and the pay is very, very well. They pay very
Wow.
well.
So any regrets traveling from one continent to the other?
My sister, no regrets whatsoever. I'm not even going to, like, no single regret. Like, maybe because I did not travel until my adult year, you know. So I think I've overstayed and I did everything I was supposed to do in Nigeria. I was a registered nurse in Nigeria. I was a registered midwife. I did a bit of theater nursing. I did
Psychiatry.
yes, I did
Psychiatry.
psychiatry. I did reproductive nursing. My first job was IVF clinic. I did midwifery. I took over 100 babies. And that's why when I came here, I did not want to do anything I've done in Nigeria. You understand? I've had enough of emergency. I did emergency. I was in emergency for a few years. I was in pediatrics. So I did everything in Nigeria. Because, when you work in general hospitals, you do everything.
Yeah.
I work general hospital, I work private, I work federal. So when I came here, I sat down, I'm like, I need something new. I need something different. Even though people will say, oh, it's a specialty that, and I'm like, no, this is specialty I've never done before, and that's aged care. So when I got here, I'm like, oh, okay. And it was around the time my darling grandmother passed away. So I'm like, okay, so people actually put their old people in a facility where people come to look after them. So that's interesting. I've never seen anything like that. There was nothing like that in Nigeria while I was there. Nursing home, old people's home. Why? And I keep telling people, we look after our old, and say, no, this different here, oh, blah, blah, blah. I'm like, okay, now I'm interested in this field. And that was where I started my career. And at the point I feel like, oh, let me try hospital. I did also, and I'm like, this is not for me. I never wanted to do mental health here because I just know it's different from what I'm used to, and the way and when I was in school, we went for some placement here and there, and I was able to say, no, I'm not going to do this. I'm not going to do that. I'm not going to, So, and yeah, no regrets at all, at all,
So
at all.
thank you.
It's
So that
been
will take us to the
bliss.
last question. I wanted to advise my audience. Like some people say it's like going outside your country that trained you, that gave you the nursing background. No doubt they gave us a very good foundation in Nigeria, and that is what we are building on. So there are some people that are still contemplating, like maybe they have the dreams, but because of what will people say, or how am I going to go about it, or it's going to take a long time. I remember that time we worked in the same area, and I could see now a lot of we nurses that have that dream that time, that had that dream that time. The dream has become a reality, and I'm happy that wow, everybody can live in their dream. See all the experiences you shared, my own personal experiences. So I was like, so actually dreams come true. So what advice do you have for those people? They don't know where to start from. They wanted to, they longed to, but they have their fears. What advice do you want to give to them?
Thank you for that question. You see, as individual, just like you rightly said, we have dreams, we have aspirations, and there's no dream that is not valid. You see, some people enjoy their comfort zone, and you won't blame them. Like, even though I don't have regrets, like I said, but I know people that be like, oh, I shouldn't have left. I feel miserable. I don't like it here. I have money, but they are not happy. So some people are like that, and that's just the foundation of what I'm going to say. Like, it's not everybody that will leave Nigeria. It is not everybody that is supposed to. Like, I know people that have moved now, and I can say that, oh, I saw this lady was going to move. You and I know that even in Nigeria, we will know people that, oh, this one is practicing like she's abroad. Do you understand what I'm saying? Like, some people, the finesse some nurses put in their job, even while in Nigeria, you will know their category, like, oh, these people will do well abroad. I know people here that they are in trouble because they are used to not doing things right. They are used to not practicing the way they are supposed to. And when they get here, they find out that, oh, You cannot. You will be in trouble. And that's why I'm saying, if you're in your comfort zone, if you feel, oh, the abroad is too much, just stay. But if you have the vision, if you know that, oh, this place is not for me. Like I told you, we came as a family. For years, my husband didn't have any need to move because it was just, oh, I'm okay here. I'm fine here. They need me here. At the point that, okay, I think I'm done. Now let's go. You know, everybody will get to that stage. They will decide, I think my job is done in this country. I need to move on. And some people will be like, no, I'm okay here. Let me just stay. Now, if you are those people, and I'm speaking to those people that want to move, start. As early as you are in the nursing school, start. Because you will need to finish your degree. Nursing in Nigeria will teach you how to be nursing abroad. You cannot put one aside, because like I told you, I was able to blend well. People did not know I just finished. At a point, they were like, oh, can you be the manager? I'm like, I finished last year. Like then I was telling people that, no, I just had my degree. Like, I cannot be manager. I'm just a baby. No, you don't look like, you don't act like one. So it will give you the confidence you need. It will give you the intelligence and, even the professionalism that you need to act in such manner and in such way that people will be like, oh, have you been practicing for your whole life? People ask me, how long have you been here? I'm like, I'm just here. There was then. And they'll be like, oh, you look like you. I said, because I've been this and this at home. So, oh, no wonder. So just start from somewhere. Start your research. If you have people, go and, because before I went into nursing school, I knew what CGFNS was. I took the form. Do you understand? I knew that at one point or the other, I'm going to leave this country. That was before I started nursing school. So you cannot just wake up one day and say, oh, I want to go and I must go. No, it's a process. Especially if you are coming from Nigeria to come and practice here. It's long. Places like United States of America, they have exams, places like, it's easier. It's a lot straightforward, even UK. But here, you have to go back to school, except you want to go through the pathway of going to another country, then moving, which is what most people do these days, So start your research, start practicing as if you are not even in Nigeria. That's my advice. When people are doing all sorts, just do your own. Follow follow the care plan. Here you can't just put somebody else's for somebody. They'll come for you. So the thing is,
practice.
Yes. I used to tell people that, okay, we do things in theory, but here, all the theories, you will put it in practical. Because if you say nursing care plan, if you say this is a care plan, you have to be going back to the care plan and be reading it like it's a novel. You have to go to the care plan because you sat down to create this care plan for this person, and the care of this person is different from the person beside him or her. Yes. So it's tailored to that patient. It's tailored to that person. You cannot just say, oh, because everybody is on this world together, we have to treat them the same way. So it's worth it. It's worth it. You will be happy you did, but you have to start.
Thank you so much. Thank you. So it's worth it. If you have the dream, start. That's where we are going to start today. My audience, don't forget to like, subscribe, put your comments in the comment section. We'll see it. She will also be in the comment section. If you have further questions to ask about going to Australia, they will be able to answer you. Thank you.
Thanks, everyone. Bye-bye. See you again. Bye.